The concept of herd immunity is something that happens within a population. This is not a public health strategy. And when you try to start thinking of using herd immunity as a public health strategy, then it becomes very dangerous. Because the way in which herd immunity is being discussed as a strategy is that the virus goes through the population and ends up infecting between 60 to 70 or perhaps even 80% of the population, and then dies out, and then the population is safe from the virus. Now, this will cause a tremendous number of fatalities, critical illnesses, hits to the economy. This is a devastating approach. Now, all the public health strategies of testing, tracing, isolation, these are very effective, but they don't eliminate the virus. And that's one of the concerns is they don't eliminate the virus, but they keep the transmission so low that we are not even close to the level of herd immunity. And so this is not a necessary approach, nor is it a safe approach, nor is it even an economically viable approach. We should not be discussing herd immunity. We should be discussing testing, tracing, isolation. Herd immunity, maybe we'll get there someday. And if we get there, it should be through a vaccine. But we don't know enough to know that's possible. And this is not what the conversation should be focusing on right now, and definitely not what public health strategies should be.
But do we even know if we can have immunity against COVID-19?
This is a crucial question, and we don't know for certain. Now, we have had some recent studies that have shown that the vast majority of patients that are infected with COVID-19 and recover show very strong antibody responses. Now, just because you have antibodies doesn't mean that they protect you from infection, but it's a good indicator. And with the very related SARS virus from 2002 to 2003, we did see that that virus produces protective immune responses that last at least for about 2 to 3 years. So the evidence strongly suggests that we will have protective immunity, but we don't know for certain that that's true. And this can change from virus to virus and person to person. So we still need to confirm, but it will most likely be true.
So you may build up immunity to one strain, but possibly you wouldn't build it up to another. Is that correct?
This is always the concern with any virus because viruses tend to mutate quite quickly. And so, if you take the flu, for instance, this is why you need a new jab every year because the virus changes so much. So, even if you're immune to one, by the next year, you're not immune to this new variant. But COVID-19 and coronaviruses don't change nearly as fast. We are seeing mutations within the virus, but there's no evidence that says that these mutations are sufficient for the virus to evade the immune system. So it is possible, but I think there's a really good chance with coronaviruses and with COVID-19 specifically that we will be able to generate an immune response that does last, that the virus won't change fast enough to escape our immune system. But again, we don't know for certain, and this is a crucial factor.
What more information would we need before we could even entertain this whole herd immunity thing?
Well, what we really need to know is if somebody that has previously had COVID-19 and recovered can then be reinfected. Now, there's some discussion about human trials, about vaccination and then exposure to see if, in fact, people can be protected. But also, as we start to look at countries that have had COVID-19 for multiple months now, if we start to look back in China, and we're starting to see more and more cases occurring in the country, even now that people have been immune, it's important to go and say, is anybody being reinfected? Or is this just still a low level of virus transmission in the country? Right now, there's no evidence that actually says reinfection. But it's that crucial area is that you can look at antibody responses, you can look at how these antibodies behave in the lab, and we've done that. And we have very good data that says these antibodies respond to COVID 19. These antibodies can block COVID 19 infection in the lab. And that's great. That's a really good indicator. But in the end, what we really need to see is that people are protected from reinfection. And this virus is just so new right now that we don't have that data yet.